It feels so amazing to help people that have been unable to be helped elsewhere in the world.
I really could not have imagined learning and training and becoming an orthopedic surgeon anywhere else.
This program has everything.
I'm Lou Lane. I'm the program director of the residency program in orthopedics at the Zucker School of Medicine at Hofstra Northwell. The program began as a hospital-based program at Long Island Jewish in the 1960s, but now it's the main orthopedic program for a 23-hospital health system, and yet we've not forgotten its roots in the care of the community, the care of the patient.
The program is distinguished by a very high volume of clinical care, surgeries, procedures that I believe create an environment for our residents to come out extremely well-trained.
I think one of the biggest assets we have in this program is that we cover 2 hospitals. We cover North Shore, which is a level 1 adult trauma, and LIJ, which is Cohen's, a level 1 pediatric trauma center. And so that dynamic gets us to see so many different types of cases and patients.
Across Long Island, if you count Brooklyn, Queens, Nassau, and Suffolk, there are 10 million people. We're in a very diverse community. Queens County is the most diverse county in the United States of America. There are 108 identifiable different ethnic groups. So the patients are diverse, the problems are diverse, and so the experience that the residents have is incredibly rich and broad.
Some of the stuff you see here is, unparalleled in terms of pathology. And as a resident, you're seeing them in the ER and coming up with the treatment plan and kind of working it through. I think that experience is incredible.
It's really been an awesome experience to not just take care of one certain kind of patient, but to learn all the different challenges and cultural issues that you need to be aware of on how to treat patients and meet them where they are.
You're never going to be wanting for a different type of patient here because you're going to get everything.
So our residency is 4 per year, which we think is a great size to be able to have enough variety in services, but also develop close relationships with our attendings.
All the faculty and attendings that we work with, they're incredibly supportive in kind of whatever we want to pursue and what our interests are.
We're all more than just colleagues. We're friends, we teach one another, we push each other, and it's just an environment that is so great to grow in.
The 3 things that I was looking for in an orthopedic residency program, number 1 was camaraderie. The second thing was a high volume operative program. And the third thing was a focus on academics. And really our program, I think, embodies all 3, and we sort of have them very well interwoven throughout all 5 years of the residency program.
So I think something that I'm most proud of for this program is the growth in our clinical research. When I started here, it was fairly minimal, and we've just grown exponentially in terms of the breadth of the research, the experience our residents get, the number of podium presentations on the national level that our residents are presenting at has just been incredible.
Our goal is to stay up with the times. We want to be contemporary. The world is changing, and we want to change with it. Residents who come here are going to be involved with all the advances that are going on in orthopedic surgery nationally, internationally.
Trauma education starts the second you walk in the door as an intern. Within a week or so of residency starting, we have the interns in the cadaver lab starting to work on techniques, and then that quickly turns into clinical responsibility where the interns are taking buddy call with more senior level residents. And then as a PGY 2 and 3 level, you're giving more and more independence as you progress as far as your consults in the ER.
Our residents are learning, they're taking what they're practicing with other attendings and incorporating it into their armamentarium of how do you treat a certain problem.
As our residents mature through the program, they have more and more of a role in setting the program.
By the time you're the PGY 3, you're making the plan and you're determining whether that patient's going to have surgery or not, obviously based with supervision, but it's your decision.
Being able to take the residents' ideas and incorporate that into the surgical plan, I don't know where else that happens.
And then by the time you're a senior resident in the 4th year, you're operating.
In the operating room, the senior residents are working with the junior residents, walking them through cases, and it's really a culture of passing down the torch from one class to the next.
By the Chief year, they are teaching junior residents how to do surgery. They're presenting papers at national meetings, and they are fully prepared to go on and become an orthopedic surgeon.
Being a chief resident here is incredible. We have so much autonomy and so much ability to display leadership skills and to work with everybody as a team.
We work hard, make no mistake. The residents work hard, but they learn a lot in an environment which is friendly, conducive, supportive.
We do work hard every day when we're in the hospital, but that does get that balance with having the time to be able to be out of the hospital, enjoy friends, family, spend time with coworkers, being next to the city, being next to the beaches. I mean, there's so much opportunity to just kind of go out and enjoy yourself as well.
Our residents are really split up in terms of where they live. Some residents live here by LIJ or by North Shore. Some residents, like myself, live in Brooklyn or even on the east side of Manhattan, which is still a 25-30-minute drive to the hospital, and kind of lets us have the best of both worlds of living in the city but taking advantage of the training and education that we get here in our program.
I think working with the residents is probably my favorite part of my job. It keeps the things fresh. It is awesome to see them come in as medical students and see them graduate as competent orthopedic surgeons.
When they come in, they're learning the procedures and learning the indications and understanding how to develop good judgment. And when they leave, they're ready to practice.
It's really a beautiful thing to be a part of.
We really want to see everyone succeed, and we think we've structured the program to be able to do that.
Residents start from the very beginning when they don't know very much and end up being as good or better than I could ever be. The proof is in the pudding. We have resident graduates who've become leaders across the country, earning outstanding fellowships. And I've spoken to the fellowship directors at these programs, and they have given me feedback that our residents are as capable or more capable than anybody from anywhere.
Our department remains exquisitely innovative, extraordinarily committed to education, and we're constantly growing all aspects of our training program. So it's a very exciting time to be here.
I think it's really difficult for anyone applying to orthopedic residency to make that leap of faith. All you want to do is make the right choice so that you can be the best surgeon you can. And I know after being here for 5 years that North Shore and LIJ has made me into the best surgeon that I possibly can be, and has given me the tools to continue to help me get better and better every day.